This is working with the Heskiers OneTool and the Heskiers method on the tennis elbow. We are going to 3 layers. First of all, we're going to open up the tissue, then we're going to make the manipulation, and then we're going to disperse the material released. For opening up the material, opening up the tissue here, we are using the small curve here that works with the interstitial fluid, promoting the flow of the interstitial fluid. You don't need to rub, you can just stroke and have a fit of the curve to the corpus, the extremity. You fit it and you stroke it. You need to stroke something in between 30 and 99. Once you feel that the tissue is opening, you start to work with the index finger protrusion. Now, the index finger protrusion works with several layers. There's a soft part of this one here that's good for sinking into the tissue. And then you have the possibility to manipulate with the protrusion here, and even go very pointy if you go up here. So you find your spot, you can palpate with your finger, you can palpate with the tool. You sink in. Once you're in there, you start to do your manipulation. Notice that I'm not dragging it over the skin. I'm just sinking in. Once I'm in there, I can either just pull it a little in a direction, or, as is the best, is to twist it. The twist by itself will make the release, the micro-myofascia release. Also notice that I don't move it as it's there. I release it, lift it up, go a little down, do the same procedure, and twist. Again, lift up, go down, and do the same procedure. You'll have complete control and feedback from the tissue. You know what's going on in there. You can adjust, make small adjustments in there. Once you have done that a couple of times, it's time for disperse the released material. So you go back to your curve of the small curve here that works with the interstitial fluid and stroke again. Something in between 30 and 99 times. Once you've done that, you can repeat the procedure. As that procedure is done and you want to go a little deeper or further, you have the option to work with the connective tissue. Here, this double gua sha curve, also called, is the one that will give you a possibility to make points come forward. It's a little more strenuous, or working with the tissue a little more hard than the interstitial fluid, and you will actually have points pop up as a kind of diagnosing where to work with your next protrusion, your next point. Notice that I'm not using this side or that side. I'm going on the edge of the curve here, fitting it into the body that the curve fits. I can either work that way, or if there's edema, I will work towards the heart. Again, working in a fairly light pressure, not any hard pressure. In real life, I would work a little hard, a little faster. I would use it like this. I'm just going to demonstrate it like this, and very soon you will actually have the points popping up to you. You will see here's points there and there. That makes it possible for me to use the protrusion of the index finger, go in and make release in the specific points. Remember, after this is released, you need to help the system to disperse the released material. So you use the curve, soft and gentle, stroking 30 to 99 times, according to what you feel is the feedback of the tissue. This is working with the Heskiers method and the Heskiers OneTool in releasing a tennis elbow.